Hi, it's Stephanie again. Let's discuss the appropriate response to shock for the healthcare professional. Some of the signs of shock in a conscious victim include anxiety, shivering, sweating, nausea and vomiting, headache, fatigue, and a rapid heart rate and respiration rate. Perform a secondary survey to check for reasons of shock such as trauma, electrocution, blood loss, and insect stings. Shock is a complex condition that can be deadly because it affects multiple major organ systems all at once, and they begin to fail due to lack of oxygenation. The definitive treatment of shock is to treat the underlying condition that caused it. That is why it is important to activate emergency medical services quickly. There are different types of shock, such as anaphylactic shock due to allergies, hypovolemic shock due to low blood pressure, cardiogenic shock due to damage to the heart, and neurogenic or spinal cord shock due to severe or multiple trauma. In spinal cord shock, the brain can't communicate with the rest of the body, which can lead to death. A shock victim may quickly become unconscious, which means that their circulatory system is starting to fail and they are lacking oxygenation. They may start to turn blue around the lips and extremities. First, check scene safety and alert EMS. Don personal protective equipment such as gloves and a mask with a one-way valve if available. If the victim's respiratory rate is less than 12 times per minute, or about 1 breath every 5 seconds, then begin rescue breathing. Deliver 1 rescue breath every 5 seconds for 2 minutes. If the victim does not have a pulse and is not breathing normally, then begin CPR. After ruling out any spinal cord injuries and fractures, elevate the legs higher than the waist. If you are unsure about spinal cord injuries, then do not move the victim. The victim may become pale, cool, and clammy, and have a rapid heart rate and respiration rate. As the body begins to shut down, the extremities start to lose blood flow first to shunt blood into the vital organs, which causes a sensation of coolness. A delayed capillary response is when the fingers and toes are pressed and take longer than 3 to 4 seconds to refill with blood. The treatment plan consists of quick thinking, maintaining the airway open, helping the victim breathe if necessary, and controlling circulation by applying direct pressure to any major bleeding. Cover the patient with a blanket or a coat, or even some newspaper if that's all that you have. Do anything to help the victim stay warm. This will enable their body to focus on fighting the signs and symptoms of shock as opposed to wasting extra energy on trying to keep warm. This concludes shock and the appropriate response. Thank you for watching.